You're someone with a vision for your practice, for your side hustle, and for your personal journey. But when it comes to establishing your path on how to get to where you want to be with your practice, things get a little messy. You're also someone who'd prefer to go in person instead of to groups and listening to everyone else's story. To me, it sounds like you could benefit from one-on-one consulting with our experienced practice of the practice consultants. From $5.95 a month and up, you can work with a consultant that will give you more direction and practical tried and tested tips matched to you and your goals. For more information, visit practiceofthepractice.com/apply. Again, that's practiceofthepractice.com/apply. This is the Practice of the Practice podcast with Joe Sanok, session number 1102. Welcome to the Practice of the Practice podcast. We are going to be doing a series between now and the beginning of November, where we are going to be playing all of our Level Up Week trainings that we did in September of 2024. We're going to be talking about from empty to overflowing, talking about your branding, talking about multi-locations, shifting from 1099 to W-2, all sorts of different things during this series. And if you want help from one of our consultants for every single phase of practice, or if you're just not sure where you fit in our memberships versus our consulting, I would love for you to talk with me over at practiceofthepractice.com/apply. We can schedule a 30-minute call together and dig into all those different areas that you want to get started. Again, that's practiceofthepractice.com/apply. Now let's get started with the Level Up Week series. Well, welcome everybody. Today we're doing a panel of group practice bosses of what they did right and maybe what they did wrong, what they could have improved on. And so we're going to just be talking through their level of group practice, kind of what they do. But let me just share a little bit about myself. If I haven't met you yet, welcome. Glad you're here. I'm Joe Sanok, and I'm the founder of Practice of the Practice. And we've helped thousands of therapists start, grow, and scale their private practices into thriving practices they absolutely love. We want you to be thriving in grad school. I always heard, we're not in it for the money, or was made to feel bad about wanting to make, money and not just struggle. And we don't believe that. We believe that money is something that you can use as a tool. And if you're a good person, you'll probably use it for good. And if you're a bad person, you'll probably use it for bad. So we work with therapists all the time to grow their practices, however that looks. So whether you're in solo, group, or a larger group, welcome. Glad you're here. We also have some guests with us today. We have Emily, Daniel, Christina, Sarah, and Matt. And I'm going to let them each introduce themselves and be able to just kind of share a little bit about their practice. Daniel, I think, is running a few minutes late, so I'm going to bring him on once he comes in as well. So why don't we start with Emily? You're unmuted. We'll kick it off with you. Why don't you just tell us a little bit about your practice, where it is right now, and then we'll dive into some questions.
Okay, thanks, Joe. So I have a group practice in a suburb of Nashville, Tennessee, and it's 2 years old as a group practice. We have 8 clinicians, 7 therapists, and 1 psychiatric nurse practitioner. And we are a private pay practice. We're kind of a boutique kind of feel. And a unique thing about our practice is that we are a brain spotting practice. So we treat, kids, teens, adults, couples, families, but one of the things that I do for my employees, which they're all employees, is that I pay for them to get brain spotting training so that we are all on the same page with that. And we're driven by a trauma-informed approach in all that we do.
And over what period of time did you start your group, and how far are you into that process?
Okay, so I had a solo practice in the same area for about 6 years, and then I am 2 years into the group practice. So I'm right at the point where I've been wearing all the hats, and I'm slowly, like in the last 6 months, I've been taking off some of the hats. I'm still wearing too many hats, but I'm feeling like, okay, momentum starting to go, and I can probably start taking off more hats in the next year.
Oh, wonderful. Which of the panelists do you want to pass it to? We have Matt, Sarah, and Christina.
Let's go, Matt.
All right, Matt, tell us about your group practice.
Thanks, Joe. So we are a group practice in Portsmouth, New Hampshire, right on the seacoast. We've got 7 clinicians and 1 admin. Our practice has been around for about 2 years. So kind of like Emily, I started my private practice, did that for about 2 years, and then started the group practice. And we've been open for about 2 years and marketing ourselves as a group practice. We primarily market ourselves to children and families in the area. That's been my niche. That's what I kind of know really well. So I tried to bring people on just in the same vein. But we also have a lot of people that have eventually come on into our practice to fill the gaps of, for parents that need some counseling, individuals and marriages. But so we've kind of morphed a little bit into that, even though our marketing remains the same.
Awesome. And Daniel, welcome to the panel. I'm just having each person share a little bit about their practice. And so Matt and Emily have gone. So Matt, who do you want to pass it to between Daniel, Christina, and Sarah?
I'll pass it to Sarah.
All right. Sarah, tell us about your practice.
So my practice is called Upshur Bren Psychology Group. I run it with my partner, Emily Upshur. We're located in Pelham, New York, which is in Westchester, just outside of New York City. And we really specialize in kind of treating the family across the family lifespan. So we do a lot of like perinatal and postpartum work with families that are growing, and we do parenting support with parents of really young kids. We see children, adolescents, young adults, parents, adults. We do a lot of family work. So we have 12 therapists with 2 admin, kind of 3. And then we have some people that do like hybrid jobs, they're both therapy and like marketing. And we have been around for 3 years. We turned 3 in June.
Awesome. And do you want to pass it to Christina or Daniel?
Christina.
All right, Christina, let's hear about your practice.
Hi. Yes. So I own Connected Families Counseling. We are in a small town. We're about 30 minutes north of Kansas City. So we serve a lot of rural population. So our goal is to provide just really quality mental health care to the local communities. And so we started out as private pay, and now we're moving towards more insurance-based just to make it more accessible. And so that way we can reach more people in our community. So I've been doing this solo practice for about 2.5 years. And then actually last year at this Level Up week is whenever I started group practice launch. And we have 4 clinicians now and 1 admin.
That's incredible. I always love hearing that, where it's like, you start one of the programs and then it's like, a year later, you're a panelist talking about it. That's incredible.
Right.
Daniel, tell us about your... Yeah. Oh, sorry. Go ahead, Christina.
I was just going to say it's crazy to see like where we're at last year compared to like this year.
So cool. So cool. And Daniel, tell us about your practice.
Yeah, thank you, Joe. Yeah, absolutely. The practice has been invaluable. It started definitely with just my office and then hiring a couple of employees to share that office space. And then we expanded to 2 offices. So now we have our own location, a 7-office suite. In addition to the 2 offices that we have, we've got about 17 clinical employees and then an admin. So it's been great. We are insurance based, so we do a lot of insurance based. So that accessibility is important to us.
Yeah.
Mm-hmm.
Awesome. Well, and part of having everyone kind of introduce themselves is to kind of know, as you listen, those of you that are participants, to say, okay, I have a question for Christina on this, or I have a question for insurance for Daniel, or, oh, I'm in New York too. Sarah, what about this? So as we look at the next hour together, I just want to frame out a couple things. So we're going to take as many questions of yours as possible. What we aren't going to do is here's one question, and we're going to have all 5 people answer it, because we would get through 3 questions. And I'm sure that we would be able to riff on a lot of different things. So if you do have a question that you specifically want someone to answer that you just heard, please say, hey, Emily, I have this question for you. That's going to make it easier for the overall flow. And if there's not a name, I'll probably have 1 or 2 of them weigh in on it. So there's a lot of different directions we can cover. I'm going to ask a couple questions at the beginning to get us going. And then as we have questions come through in the chat, please go ahead and put that there. Now, if you have a question that you think needs a little bit of back and forth, maybe you think there's going to be a follow-up question, just virtually raise your hand where you see react at the bottom of your screen. When you click on that, you'll see some reactions, but then at the very bottom of that, you'll see raise hand. That just lets me know and our team know that you are willing to come on camera or to at least unmute and to ask your question if it's a little more complex than maybe the chat. So let's start. Christina and Daniel, I want you to just talk a little bit about insurance. And so Christina, you said you're in a rural area. You're deciding to move away from private pay. Daniel, you're insurance based. Maybe Christina, talk about that transition of deciding to take insurance and just some of the nuts and bolts that went into that. And then Daniel, would love to hear a little bit more about, for you, how does insurance pay tend to work for your practice?
Yeah, so with us, we decided to make the transition about a year ago just because it can be a lot in marketing to get private pay clients, and especially in our area. And so we really wanted to make sure our clinicians can stay full. So that was what made this switch to insurance easier. To help it out, we got a biller because we're like, this is just an extra step just to make it just a smoother transition. And so that has really helped us out to have somebody who can answer those questions, and it's not extra work on our part necessarily. It's minimal work.
So really kind of making sure that you have a team of people that know what they're doing, that you aren't starting from scratch.
Right, because billing and insurance is not my skill. So I'm going to hire that out to somebody who can do it a lot better than me.
And even if it was your skill, how Emily's talking about, she's taking hats off and realizing, okay, like we got to where we're at because of bootstrap and wearing multiple hats, but to get to that, 10, 20, 30 clinicians, if that's her goal, you have to start taking those hats off. Daniel, for you with kind of the logistics of insurance, what does your team look like in regards to that workflow and also that decision to take insurance?
Yeah, that was definitely a decision that shouldn't be taken lightly. It was a lot of work, and during the earlier stages, I was doing most of the insurance, and I'm not an insurance guy, so there was a lot of learning, a lot of research, and a lot of calling, lots of wait time, lots of back and forth calling the wrong number. It's true, it can get pretty frustrating, but now that we got a little bigger, we have an admin, and so pretty much it's just growing pains. It's doable. It's not rocket science. It just takes time.
Yeah.
But he handles it. So he's good.
Yeah. Emily, now you're 100% private pay. Tell us how you came to that decision. What do you think are some of the pros of that? What are some of the difficulties that come along with that?
Okay, I'm glad you asked. Because we are in a transition point, actually. So we are private pay. I came to that decision because I wanted to pay our therapists well. I really wanted to foster, excellence in treatment and to attract, therapists who wanted to be paid well. And what I'm finding is, I guess with the community our size, as a suburb of Nashville, it's kind of a smallish town. And it's been challenging to fill the caseloads of our 8 clinicians. So we do a lot with marketing. Google ads are what we spend the most money on, and we hired a local marketing company who helps run the Google ads as well as run our website, like the SEO of our website. We market in a local little magazine, and that's been very effective. Also, what's been incredibly effective is me getting very involved in the community. So I'm kind of the face of the company, which is called Tennessee Mental Wellness, by the way. And so I'm involved with the chamber in Gallatin, our city, and do a lot of speaking with local businesses. I targeted the businesses and do corporate wellness kind of speaking. And then in the schools, I sit on a mental health committee of the county. So those things really help to get our name out there. But I'm seeing now 2 years in that, I would have thought that our clinicians would all have very full caseloads, and some do, but not all. Also, I have 2 part-time admins, and one of them, they both answer the phones, but one is also office manager, and the other is also marketing. So she does a lot of our networking. She goes around to lawyers and physicians' offices and distributes flyers and cards and stuff like that. So that's what we do. But the transition thing is that we're going to keep a private practice, and then I'm going to add a practice that is insurance and start to grow that in the next year.
Awesome. Well, we just had a question come in, and I'm going to have either Sarah or Matt kind of field this one. So could paying a clinician well be accomplished through a more generous split, assuming one hires 1099 contractors? I should have asked who has W-2s and who has 1099. So why don't we, if you have W-2s, do a W gang sign, and if you do 1099s, do a 9 gang sign. All right, so Matt's the 1099 guy. Daniel's gonna probably pop back in here. Matt, why don't we ask you that? What are your thoughts? What are your thoughts on a percentage split versus, a flat fee, also paying a higher percentage? Like, how have you thought through the money side of it since you have 1099s, and that's this question?
Yeah, so it's an interesting question. I've tried to be able to be really generous to people who, in terms of experience, trying to reward that, people who are, maybe doing a little bit more work for us, maybe more full-time clinicians than someone who's a little bit more part-time. So we kind of have a more generous split with those people. But it's really important that I kind of think of it as our business. If our business doesn't survive, these people don't have jobs. And if they don't have jobs, then we can't support the community. And so it's really important to make sure that we offer a split that is really competitive, because I really want to pay our people really well, but at the same point in time, keeping that other mission in terms of keeping the business going at the forefront. So it's not an easy, straightforward question, but I feel like I try to do my best to make the split feel even for everybody that works for us.
Yeah. Are you willing to share the split or kind of some of the principles that led to what your split is?
So we go anywhere between, we usually start off at about a 60-40 split for the beginning. And then once people hit a certain percentage of their caseload, if they're full-time, just because there's a lot of support that goes on in the beginning, a lot of my time, a lot of things that I outsource in terms of we do a lot of insurance credentialing too, and we take care of all of that for our clinicians. So there's a lot of that comes into it as well, in terms of paying somebody to be able to do the credentialing. That's something that I've just decided to take off my plate. So once they hit a certain level in terms of their caseload, then we bump that up to about 65. And then if we have people who come into our practice who are private pay, because we're very clinician centered in terms of what they want to be able to do. So we do have people who are private pay, and they're on the higher end, around a 70-30 split.
Awesome. Cool. And Daniel, you got popped out of the spotlight. Are you W-2 or 1099?
Yeah, W-2.
Okay, that's what I thought I heard you say, but just wanted to make sure. Okay, cool. There's a question for you, Emily. And in a second, I'll show you all our staff wage calculator that we're giving away for free. I won't go through all of it, but it's a great way to then run those numbers so that, if Matt's saying, okay, we're doing a 60-40 split, what does that break down to? Where you can look at what your profit margins are and all of that. It's something I've used with my own consulting clients that we turned into an actual product that people can use. But the password that I have for it to get into it isn't working for some reason. So I got to find out what the new password is from Jen or Sarah. But while they're looking for that, Emily, how do you separate the private practice and the insurance practice? Will they be in the same location? Will they have the same clinicians and serve both practices? How does that work?
Okay, so I know a little bit about this. I'm going to be working with one of your consultants, Joe, Melissa Schneider, starting Friday, actually. But from what I know, from what I understand, I will need to have 2 tax IDs, so essentially 2 separate practices. So I'll have 2 tax IDs. I'll have the insurance practice and then the private pay. And, the clinicians can work for either practice. We will start at the same location because we have room still at our location. But I plan to have the private pay practice stay in Gallatin, and that's kind of that's what we do. And then the insurance one will be more scalable. I'm finding that the private pay practice really does well because of us being known and me being known in the community. I had my solo practice here for 6 years and started to, build a good referral base and stuff. So I may consider, scaling the private pay, but the insurance is what I really want to build and scale that one.
Awesome. Cool. I would love to just think about, like, how do you think about scaling, Daniel? So you have a larger practice, you've done that in a short period of time. I think there can be this desire, this kind of hustle mentality that's like, I always got to do more, I got to do more. Like, how do you know when enough is enough? How do you think through scaling, growing? Like, just what's your thought process around that?
It's funny. We just had a group consult, and that was something that we discussed was the spectrum between striving and being. So I think that's right on point. When do we say, okay, let's just be a practice instead of, well, I guess to be honest, I haven't reached that point. That there was that moment where we had that 2 offices, and we jumped into the 7 offices. I mean, that was striving, and I think we had just gotten to a point, Joe, where we filled the offices, we're full. Our clinicians are just almost right there to being full. So I think the time is now to say, okay, I think 17 is enough. Let's cruise this ship for a bit before we decide on the next step for us. I don't think it's the end, but
Yeah, that makes sense. Now, Christina, if we went back to kind of the beginning of your group practice, like, you just a year ago, decided to jump into this, and I'll let kind of anyone else also weigh in on this, because I think this is an important question. We don't have to necessarily hit all 5 of you, but if you have ideas, feel free to jump in after Christina answers. Like, what do you wish you had known maybe in the couple years before you started your practice? Like, what could you have done even before you launched it? And what have you learned since you launched your practice that you wish you knew earlier on? And then we'll answer this. And then Ingrid, I see you raised your hand. We'll go to you to get your question.
For me, I think I wish I would have worked more on my leadership skills and stepping into that role. I think I've always been a great follower. And so stepping into the leadership role was a challenge, but I think going through group practice launch really helped me because, whenever it was going like LaToya, like we had all those meetings with her and like her voice would pop into my head and like, no, Christina, like you've got to do this. So like remembering like I'm the captain of the ship, like I have to be the one who's leading. And I think what I wish I would have done differently is I think I wish I would have interviewed better. I think I wish I would have pushed in the interviews a little bit more. But I would make excuses. I was like, oh, like this will just level out. Like it's just interview nerves, like things will level out. And they never did. They would only get worse. So now what I do is I have my admin. I have a lot of trust in her. She'll do the initial phone interview. Like it's just the basic questions. And then she'll tell me like, hey, Christina, like, I don't even know why this person wants to be a therapist. Like, I don't even know what they're doing as a therapist. And so we'll pass on those people. Or she'll say, you know what, they've got these great skills. And then I do the interview with my husband, who's also the co-owner. And so he sees my blind spots and we look at things through different lenses. And then usually, like we're all in agreement with the next people. So having those checks, I think has been beneficial. And then also what's really helped has been just having the group practice launch system, because like that helped me have a system. Because around this time last year, we're like, like, let's start a group practice maybe in February, like, let's begin. And I was like, well, no, like group practice launch is starting right now. Like, let's get it done now. So it was a little bit chaotic, but I think, it's going to be chaotic either way. And I'm glad we jumped in and I'm very thankful for where we're at now.
Awesome. Other things that you, any of the other 4 that you wish you had either known in, say, the couple of years before you launched, or that you've kind of learned in the years since you launched?
I'll jump in and say that I think something I learned in group practice launch was, or somewhere along the way was having a good admin in place. And so my admin was my first hire, and I now have 2 part-time admin. But she was so fabulous. A stay-at-home mom turned part-time admin turned practice manager. And she was so helpful. I would say, okay, I have these ideas and, I'm learning all this stuff in group practice launch and like, help me distill it. At the time I had already spoke to my first, who would become my first hire. And I knew I'd probably hire her. So my admin came, 2 months before we started onboarding the new hire. And it was so great, for me to say, I have all these ideas and all my onboarding processes, and she would help distill it and organize it and help me with setting up everything. Really, she was fabulous.
Awesome. We'll get to more of that. Let's go to Ingrid. Ingrid, you've got a question. I just added a spotlight, so you're with us here.
Thank you. Thank you so much.
Yeah, welcome.
Glad to be here. Wanted to follow up and get so with Emily, and thank you for answering the question. So I have a group practice right now. It's 10 clinicians and myself, but I'm not doing a lot of therapy anymore. But we have a couple of couples therapists. And as you may know, there's this big thing with couples and insurance, and it gets really muddy. And so I actually was doing the opposite. So I have a group insurance-based practice, and I wanted to do a private pay for couples. And I actually set up the LLC. I did all the work. We got stuck with clients calling and saying, but I see you take insurance. We're a different practice, all this, but your clinicians are the same. Like, how come? And so it was very difficult, to the point where I had to put that on hold. And so basically my question, or what I'm looking for, is there a better way of doing it?
The only thought I have for that is you may want to have a separate website. So you have a website. Oh, you did?
It was a separate website, separate EMR, everything was separate. It was just the fact that, for example, let's say I was seeing an individual and they say, oh, we need couples therapy. Okay, so there is this service, and, oh, but your clinician is in the same practice. How come I can't use my insurance? And so it became very entangled, I think.
I definitely get that dilemma. And since I'm on such the early side of, having the two, I don't know. I think we would encounter that same challenge, I imagine. And I think we would just try to make it known that, like, we don't take insurance for couples. We just don't. That's just, because Tennessee Mental Wellness will be the umbrella practice, and then the insurance will be under that. And so, but in general, and I think that the insurance practice will also be Tennessee Mental Wellness, but an LLC, whereas the umbrella is a S corp. But so that just in general, our policy is to not take insurance for couples.
Yeah, it sounds like next Level Up week we'll get an update as to how it goes.
Yeah.
Excellent. Whatever stage your practice is at, we know using great resources with patients is crucial to helping them get better faster. As a practice owner, I never compromised on this, but finding the right materials was a constant challenge. It's so time-consuming, especially with everything else to juggle. That's why I recommend Psychology Tools, an online library of over 500 evidence-based resources for whatever problems your clients are facing. Choose practical exercises, handouts, and worksheets, audio therapy, treatment manuals, and loads more. They're even available in multiple languages and formats. Developed by highly qualified psychologists, resources can be downloaded with therapist guidance to enhance skills or client guidance helping patients make the most of each tool. It's a game changer for saving time when delivering more effective therapy. As well as a great resource library, Psychology Tools is also a smart business tool, boosting productivity and efficiency. Focus on growing your practice while your team feels better prepared for every session. It's a win-win for you and for me and for the client. Visit psychologytools.com/Joe to find out more. Use code JOE24 for 20% off new subscriptions. Again, that's psychologytools.com/Joe to find out more. All right, we've got another hand raised. Let me add a spotlight there. And JP Ben, welcome.
Thank you. Thanks for letting me ask a question. So, and this is for anybody. I'm ready to hire my first one. I'm going to go the 1099 route. I've got plenty of office space. what is everyone's best place to find clinicians? Is it Indeed, Facebook? I'd love to hear any and all sources from which you find clinicians.
Awesome. Such a great question.
Ooh, I have something to say about that. So I've used Indeed, and I've hired one of the 8 from Indeed, but two great sources have been my networking in the community. So I've reached out to, I had my admin set up like coffee dates with kind of early career clinicians or pre-licensed clinicians, and just ones that I knew weren't established in their own solo practice, and just talk to them, got to know them, and then that turned into hiring 3 of my clinicians. So that was very helpful. And then the other thing was, I learned this from Dr. Elizabeth Carr, who's part of Practice of the Practice. Her idea was to have separate web pages for each job description that you want to hire for. So because, I wanted to hire for a psychiatric nurse practitioner, and then a child therapist, a couples therapist, so separate web pages so that they can show up in searches. The day after I created my psychiatric nurse practitioner, I got an application from one that I ended up hiring. So that was very effective as well.
Yeah. Sarah, Matt, what about you guys? You haven't had a chance in a little bit.
Yeah. So could I ask what types of clinicians are you looking to hire? Because that's also kind of a factor to consider.
In terms of their niche?
No, in terms of like master's level, doctoral level, early career, experienced, trainee.
Probably mostly early career, master's level.
Provisionally licensed or fully licensed?
I'll take a provisionally licensed. I even have there's a clinical supervisor that's just renting office space from me right now. So I think I could have that supervision covered.
Fantastic. So because our practice does sort of 2 different ways of recruitment. We recruit for fully licensed, more seasoned clinicians, but we also have a training program. And our training program, it's postdoctoral, provisionally licensed clinicians, and also master's level interns. And so for the master's level interns, they don't have a provisional license. So that we're looking to connect with schools. But if you want master's level provisionally licensed, which we also have, but they've sort of graduated up to that point, we didn't recruit for those positions. But another good place to look for is like training programs and kind of postgraduate programs. So like if you are connected with your local clinics and your local hospital systems where you might have trainees running through, they might, like their training director is probably helping those graduates find placement and stuff afterwards. And there's usually listservs that kind of circulate inside of those programs. So to connect with training directors at internship programs, practicum programs, and just letting them know, hey, we're hiring, hey, we're looking to build out. And I think a really important thing you want to speak the language of the clinic director, or they want to know that the people that they have trained are going to be still getting the kind of like quality training and support that they've been kind of giving them. So highlighting, this is the supervision, these are the didactics we offer, this is the professional development we offer. How am I supporting these clinicians come into a space where they're going to continue to grow professionally and clinically? You're going to get a lot of, people want to put their students in places that aren't going to just therapy mill them out. And so if you can highlight what you're providing in terms of clinical supervision and support, those directors of training programs are going to be more inclined to be like, oh, I heard about this, and pass it along.
Sarah, I think that's such an important point in like connecting with grad schools, because when I had mental wellness counseling, we didn't have the capacity as a private pay practice to do internships, but I would speak in the classroom about private practice every single semester. And every semester I would have 2 or 3 people come up to me and say, my dream is to work for mental wellness counseling when I graduate. And I'm like, here's my cell phone. Let's keep in contact. I can help you with internships and we can talk about what kind of trainings you want. So then when they were done with their internship, they'd always join my supervision group. And then in there, I could kind of foster them to join the practice. And so having this kind of long tail approach of making those connections early on with students, I think is so important. Matt, anything you would add to that?
I would say the what you do for your own networking too is pretty important. So I've been involved in a lot of the mental health community for a while here in our state, and in particular with our marriage and family therapy community, and doing a lot of work with them. And I've just found that, not like as you get to know a lot of other people that have kind of come up into the field, I've gotten to know a lot of other group practice owners. And just through that, people just sort of learn who you are, who your reputation is. So yes, we've found a lot of people through Indeed, and that's been great. People also filter through us that way, just by our reputation. So I know I've had people who have reached out to me before and they were a fantastic candidate, but just not a good fit for what we do. And I've been able to, reciprocate that and be like, but there's this other group practice that I know in the area that's fantastic. Let me help you and support them. And, they've kind of referred people our way that are a better fit for our practice. So networking with people in the area has been huge for our practice.
So awesome. There's a bunch of comments also that other people on our panel put in the chat. So, things like LinkedIn and other places that you can put that you're hiring. Let me share with you just the way the staff wage calculator works. This is something we put together for our consulting clients. So the way it works is you walk through like total staff, how many total full-time staff do you have? So if you have 2 part-times, you can kind of do the math on that. What's their average reimbursement rate going to be, or what is it? Total sessions, and then how many weeks per year. Then that's going to figure out the annual gross per clinician. And then as we start to add in some of these costs, so thinking about admin, how much do they get per hour? How many hours do they work for how many weeks? How much does that cost per year? Thinking about a supervisor. So is there a supervisor? Is your time as the owner, if you're doing, say, 3 hours a week working on that, we want to make sure that we're counting that time, as time that you're not just donating to the practice. So say you're making, what would it take to replace you as a CEO, not as a clinician? Maybe that's, $100 an hour if we had someone that was CEO level, that was running this practice full time. So to then it'll do all the math for you. And then some of the other things that you can add in here are your like annual marketing budget, insurance, if there's a percentage, rent, IT, miscellaneous, because everyone has all sorts of different other things that they would add in. Then what you can do is you can toggle it by hourly or by percentage, and it'll do it for you. And so this will all change then once all those numbers are in there. So then it tells you what is your profit margin, how much are you actually taking home, what's your gross revenue, what's your net profit, how much are you making per clinician with this. So it's a really just important way to think about how we're doing our percentages, because sometimes we can say, hey, I want to really like help my clinicians like have a good living and all these things, which are good. We want that for people. But then if you're working 50 hours a week and you're making less than your clinicians, like that's not okay too, because you're taking on a ton of risk when you're starting a practice. So it just really kind of helps you with that. Let's dig into a few more questions from our community and for the 5 of you. Let's see. So next question. My tax guy told me that being an S corp is better from a tax perspective. So anyone want to weigh in on that? I know that I've heard that from my tax person as well. Of course, none of us are accountants or attorneys, but is that something that 1 or 2 of you could weigh in on regarding how you think about taxes?
The one thing I would say, and again, I think this is where it's really important to go find your team.
Yeah.
Because you could spend a lot of time. I mean, personally, when I started my private practice, I tried to DIY it and I ended up with an LLC when I need to have a PLLC because I have a professional license in my state. You have to have a PLLC. So I find that honestly, the best thing to do is to really there's certain things you just outsource. And one is when you're incorporating, get a lawyer who knows what they're doing, who can help you figure out what's required in your state with your specific license, with the company you're trying to build, because you can waste a lot of time and money if you don't know you don't know what you don't know.
Sarah, I'm really glad you said that. And even like Tracy's saying in the chat, in California, you can't have an LLC. And it's like, yeah, you need to do it right in your state. I filed with an online filer. I won't say them. And then I ended up working with an accountant probably 4 years after I had filed my LLC, did TurboTax home and business. The first year when we restructured it, it saved me about 15 grand in taxes. It was just like, oh my gosh, that is not worth the $199 I paid TurboTax to do this to not get any advice. And so I'm with you. When you have a group practice, it's just worth it to have a accountant that knows it, to have an employment attorney that you can call if something happens, all those different things. So awesome. Let's see. We have Joe's done some great trainings in Circle to help you find your team. Thank you, Sarah. Appreciate that. Let's see. So Daniela says, I am more of a coach and educational therapist, so I don't need a license, and I would like to hire individuals under 1099. Daniela, would love for you to unmute and come on, and maybe if there's some follow-up questions, I bet the panel has some ideas around that if you're willing to have us put the spotlight on you.
Hi, how are you? So basically, I left the school system. I started a practice like 30 years ago. I get more people than I could possibly take. I created programs. I just need people filling seats to be able to deliver. And because I don't need a license and I just wanted 1099 and bring people in using profit sharing or something like that, would LLC, S Corp, like what would be the way to envision something like that? I'm looking for people to be able to grow themselves, but the same token have a platform, because I'm finding people in my line of field, they don't necessarily have a process, and it's a forever thing. And I just think, I like the way I do things, and I would like more people to be able to get help, because I can't service people wait for months. And it's my lack of, business savvy and understanding how to grow and how to hire. So, but would you be a LLC? Would you do S Corp if you're 1099ing? You know what I mean? And there's no licensure involved.
Let me actually jump in here first, and then if the five of you have extra things you want to weigh in, I want to just clarify a couple terms. So you use three different terms that have three different areas. So first, your LLC, for example, that's your business structure. So that's protecting you from a personal lawsuit. And again, I'm not an attorney or accountant, consult your own. But my understanding of it is that, if someone sues my LLC, they're not able to sue me personally. So that's your business structure. S Corp, C Corp, sole proprietor, those are all legal taxation terms. And so it's how are you taxed? So you can be an LLC filing as an S Corp, meaning you're paying taxes as an S Corp. And that's about the level of my knowledge. And then that's where accountants take over.
Oh, I get it.
Yeah.
I didn't realize that.
And then the other side, the 1099 versus W-2, that's the structure of the relationship you have with your employees or your contractors. And so employees are W-2 employees. You're paying different sets of taxes. Contractors are pretty independent. So I think for you, and I'd love to hear what the five of you think, it sounds like what you're talking about is having people learn your model, follow that model, and that somehow makes you money. Is that an accurate, quick assumption of kind of what we're talking about?
Yeah, use my platform and my program as a way to help guide therapy so that we're all talking the same language and it's done faster.
Yeah. So I think asking yourself, how much do you want to manage people? So if you want to manage people, have them follow your ways, like you have to do it this way, it's a little more W-2. If you want them to be able to show up, and sometimes they use what you're saying and sometimes they don't, that's a little more 1099. I think there's a third option we haven't discussed, and that's you creating a certification program where people go through, say, an e-course, and then they're required to, say, monthly do supervision with you or have some sort of annual certification, where it's sort of like, the Gottmans have their level 1, 2, 3 Gottman certified therapists. You could create something like that then they would go just run their own business, but with your model and have fidelity to that model where you don't oversee them. So that's what comes to mind for me regarding Daniela's question. I saw, Emily, you unmuted. Did you have extra things to add to that?
Oh, you did a great job covering that. The only other thing that came to mind for me was that from what I understand, correct me if I'm wrong, and it could vary based on your state, but in a 1099 model, each contractor really should have their own LLC. You're hiring their LLC. So that's something to consider too. They need to be their own entity that you're contracting with if you do 1099, at least in my state.
Okay.
Yeah, I think I required because I had 1099s, and I actually wouldn't do that if I were starting a practice now just for myself in Michigan and for retention. But I required people to have an LLC that I paid, that I wouldn't pay them directly. I'd only pay the LLC. So that was part of our contract.
Well, so here's the question. The question is, if you're starting out, the only reason why I wanted 1099 is because I don't have the money to be able to start supporting having full time, and they get the freedom. They make their own schedules. They just give me a calendar and say, this is when I'm available. This is my perfect schedule. But because a lot of people just don't have a process, I just want to give them like a basic process so that the executive functioning is, accomplished faster. So how would you onboard more clinicians if you're trying not to hire them full time, since people who come into my office, I can get them at 8 o'clock for what I do, but most people couldn't get them in until after 3.
So
So that's
what you're
the problem.
saying, I don't think is going to be solved by 1099 or W-2, and any of the five of you can push back, because you can have a W-2 that you pay hourly or that you pay as a percentage as long as it's above minimum wage. So, I mean, you don't have to have someone be a full-time employee from the get-go. You could have someone that's hired at, you get paid $50 per hour. When you're doing this work, all the money flows through the business. We set it up with a W-2 with like Gusto to have all the payroll done correctly. And then when the money comes in, they get paid. In the same way that if someone, works at an ice cream shop, they're not hiring people full time for the summer. They're getting $16 an hour. So, same sort of model where they're just a part-time employee. Other things that you would weigh in on, that comes to mind for the five of you in regards to Daniela's question.
One thing I think is important when you're trying to decide 1099 versus W-2 is this comes up a lot with I think a common misconception is that what you're speaking up, Joe, is that if you have W-2 employees, that means they have to be salaried. And when you have professional licensed people, well, either way, but like if you have professionally licensed employees, there's like piece rate pay, which is different. Like that's sort of what we kind of call fee for service. It's not hourly, but it's not salaried. They're getting a piece of the rate that is billed by the practice for the work that they do. And that can be W-2 or 1099. You can give that kind of compensation model to a W-2 employee, and you can decide if it's part-time or full-time. So our practice typically works by employing all W-2s who start out at part-time. And once they hit a certain threshold of cases per week, they can move to full-time. And the pay is based off of a piece rate pay. So they make it's the same as a fee split, it's just a different way of describing it. Like they make a piece of the rate. And we present it as a flat rate, not a percentage, though it's calculated off of a percentage. Mm. So I think people think that W-2s mean they have to be salaried or hourly, and that's not how it has to be. You can have W-2 employees and pay them in this sort of piece rate way.
Awesome. Daniela, thank you for that question. And, this is the kind of conversations that we have, when we're in Group Practice Boss and Group Practice Launch, where, we don't ever claim with Practice the Practice that we have the corner on information. We believe that a community of people is going to be more vibrant and smarter collectively than any single one of us could be. So, even Sarah breaking down, piece rate pay. I'd heard that. She did a better legal description than I would have done and made this webinar even better. So same with the other five panelists that have joined us. One question, and I see that some of the panelists are putting it in the chat, is what's your favorite business book or finance book? So if each of the panelists, if you could just type that into the chat as to your favorite business book or money book. So I want to give each of you just a chance to maybe give just like a 1 or 2 sentence just answer to what do you think makes people successful in group practice? Let's see, Daniel, we haven't heard from you in a while. In a couple sentences, what's it take to be successful in group practice?
I think that if you're going to open a group practice, you're going to need to learn leadership and management skills. Unfortunately, I think the hardest part about it is you've got to be ready. And people say this, but I think the most challenging thing for me was when I had to let somebody go.
Yeah.
It was really emotional. And I'm really thankful for my coach, helping me discern, like, okay, like the carrot or the stick? How harsh, like, am I overreacting? Like, these are all these questions that come up that I had to learn and navigate. Where do I set my boundaries? Where can I be more lenient? Uh, and how can I make sure that everyone knows what we're doing, our values, and everyone's on the same page with our values? Because it's such a responsibility. Because it all comes up, and every single issue that goes up the chain, that's going to be the most complex issue for you, and you have to like decide it. And it's never an easy question, or else it wouldn't have come to you. And that's just part of leadership. But if that's your cup of tea, then I would say it's very rewarding to be able to reach out to the community in a way that has just a little bit of influence for good.
Awesome. Thanks, Daniel. Who do you want to pass it to?
Let's pass it to Christina.
Christina.
So I think what makes a person successful, just looking at my own journey, is having a system in place. And that's why we started with Group Practice Launch a year ago and continue with Group Practice Launch, is having a system and then the consultation piece in there, because you don't know what you don't know, and having other people to lean on and help you figure out some of those hard questions that come up. And, it's not something that you've planned for. And really, like Daniel said, having to dig into that leadership side and figure out, how do I make these hard decisions, and having other people as consultants can be incredibly helpful. Also knowing your why, because it's nice to do group practice for the financial piece, but it can be so emotionally taxing and challenging. And if I didn't have my why solidified, I would have given up. Because it is hard. And, I know it is worth it for me, because I know my why. I'm grounded in that, and just that effort and discipline. I think also whenever it does get challenging, or okay, this is rough. So systems and consultation, and then knowing your why and that consistent effort. I think that's what helps a person be successful.
Awesome. Who do you want to pass it to?
Let's go with Sarah.
I have two things. One is to really be intentional about building your team. You want to really, it's so much harder to take, kind of like Daniel was saying, it's so much harder to take away than it is to just really add intentionally to begin with. And that goes for clinicians that you're bringing in, administrative support, eventual leadership, and then you're outside of your practice team, like your accountants and your bookkeepers and lawyers. These are really important intentional pieces of the puzzle, and having a really solid team that understands what your vision is, what you're trying to do, and has buy-in into what you're building is really important. And the other piece that I thought of, because I was thinking about my bookkeeper, who was I couldn't run this business without him, is you need to know your numbers. You need to look at your numbers. You need to know your numbers. You need to understand what your profit margins are. You need to understand what is coming in and out of the business in terms of your finances. You need to know cash flow. This is not stuff they teach us at all in grad school. And yes, leadership, soft skills can be kind of extrapolated from a lot of our clinical know-how, but business and finance and numbers, you have to kind of be willing to learn that stuff, because even if you outsource it to a bookkeeper and an accountant, you have to understand what's happening to make a lot of these on-the-fly decisions, and to have a long-term kind of plan for where you're going. So yes, have a great team that you trust and who gets it, and know your numbers.
So awesome. All right. Who do you want to pass it to?
I'm going to go with Matt.
All right, Matt.
So quickly, I'll echo the intentionality that Sarah just talked about. I think it's really important to be intentional, but then on the flip side of it, it's really important to get comfortable with being uncomfortable. At the beginning, when I started my practice, I saw this, and it pops up into my head all the time. It was a meme, and it was of a man strapped at the front of a train building the tracks as he was going. And I always think about myself in a business every single day. Some days that's what it is. And so, being intentional is important, but also some days you're building the tracks and just try to keep things on track. So learn to be comfortable with that.
Love that. Emily, wrap it up for us.
Okay, I echo everything everyone has said, and I'll summarize it like, you are now a business owner, and so you're a business owner first, clinician second, leader, all the things come secondary to being a business owner. So get very skilled, create the team, like Sarah was saying, to be able to get a team, to get skilled at, systems, numbers, think like a business owner. And it's a skill that you will grow into. So get the support you need to be able to grow into that.
Awesome. If all of you could just go down to react at the bottom and pick a emoji that to you is your reaction to these panelists. And I'm going to do rocket ships because you're helping us all just like blast off. Got some clapping, got all sorts of things coming in. So awesome. All right. Thanks all the panelists. Thank you all for joining us. Talk to you all in half an hour. Thank you so much for listening to the Level Up Week series. I hope you are getting so much help out of this. If you need extra help, head on over to practiceofthepractice.com/apply. I would love to spend 30 minutes brainstorming with you as to your phase of practice and helping you determine whether a membership community or consulting is right for you. Again, that's practiceofthepractice.com/apply. And we couldn't do this show without our amazing sponsors. I wish I had a better online library of evidence-based resources to use in my practice, and Psychology Tools is the place to get that. Psychology Tools is a smart business tool also that helps you with productivity and efficiency while giving your clinicians and yourself better quality materials to give your clients. You can get 20% off new subscriptions over at psychologytools.com/Joe and use code JOE24 to get 20% off of any new subscription. Thank you for letting me into your ears, into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.